First of all, we are people, and down the road we can get sick, or we might be called to take care of our people that we love that can get sick, or just friends around us. What I will talking today is People Who, which is a new platform that is about people and dialogues around diseases and conditions. I think I have a little bit of issue because that's not the sequence of that was expected. But we'll try to cope up with this. Can we launch the video, please?
We are people, and throughout the course of our lives, we live with an illness. There are people who live with a temporary illness, and others with a chronic illness. There are people who have a simple ailment, and others that suffer from a serious illness. There are people who are not ill, but take care of those who are. There are also people who are interested in the illnesses of others with whom they interact. Now there's a place on the internet for those who want to live better with their illness. People Who. A place to talk with people who have a similar situation. A place to monitor the control of the illness. A place to find tools for mobiles to make everyday life easier. A place to share all you've learned about your illness. A place to find all the handy information you need. People Who, a place for people who live with an illness. Available in several countries.
Okay, so this is what People Who is about. As you heard in the video that was playing out of our Vidium.com platform, as you have seen by the subtitles, is being piloted in Spain and is being rolled out to multiple countries as one cloud-based platform with user interfaces and websites that are specific to different languages in different countries, and of course that adhere to the regulations of the different environments. The invitation from Denise today was about data, and People Who is live since few months. So I will be showing for the first time some data that we extracted for the platform as it has been rolled out. So since till May 2013, we have 2,000 plus users. And as you can see on the chart, the idea of having people with conditions, people that are taking care of relatives and people interested to the conditions is already happening, because we have a breakdown that was kind of even surprising, because we have half of the people with actual conditions, and then we have a breakdown of the other two groups, all collaborating together on the platform. The platform is made by specific diseases. So imagine it's like a larger community, but then within the community there are sub-communities, one for each vertical disease. Why this is important? Because the needs of people with diabetes are completely different than those from bipolar disorder, and even the interactions among the different groups between those affected and those that are taking care is completely different too. So once you get access to the platform, you basically then get verticalized in your condition or area of interest that is pretty vast, and within that the interaction takes place. So this means that the platform can scale up, adding more disease and conditions as we keep going. These are the breakdown of users by the 5 areas that are already available, which, as you can see, are epilepsy, transplant, arthritis, diabetes, and bipolar disorder. This is for the Spanish users where the platform was born. And this is a little bit about what are the demographics that we have seen within the platform. It's interesting that these are real users, you know? So the age range and the gender dynamics are fairly a good overlap with what you can expect from a disease and condition standpoint. The other great things that we are observing is how the interaction is growing, how we measure the interaction. We have a host of KPIs, but this is sort of a super KPI, it's an aggregation of all the different kind of interactions, likes to posts, you know, few of these things. The platform is growing with basically 50% of more engagement each 3 months, which means that people are picking up quite fast the interaction on the platform itself. What's happening within the platform? The platform, in one of the charts that unfortunately we haven't seen, is organized in a forum area where people can have discussions, pretty much like a Facebook, but private, closed, is all password protected, all the kind of things that you can imagine. Maybe we'll talk more in the Q&A. There's a data section where you can perform self-tracking, and there are other areas where you can download apps that allow you to track data about your condition, and of course, supporting information. When you look at what's happening in terms of conversations, it's not only about symptoms, signs, or labs examination. You see that there's, of course, treatment, but there's a lot about food, there's a lot about impact on job and ability to perform regular life activity. There's discussions about how to relate with the healthcare system around. So it's quite interesting how these dialogues are taking place well beyond the pill and well beyond the strict medical aspect of it. And this is a little bit of a focus on what I was mentioning before. On the web, we have basically 3 big areas these days. You know, we have the information, we have the social side, and we have the tools. Pretty much like Web 1.0, 2.0, and 2.x, as we are starting to say. People who is trying to create a coherent environment where by disease, you do have access to all of this in a consolidated and integrated environment. So you have your mobile app to track your own data that feeds your personal data center, and that is related to your community where you can engage in dialogues with other patients or with caregivers, with friends and relatives. And this works in an integrated fashion. This is a little bit of dive on one of the mobile apps that are available. Again, the apps are strictly thematic. So there's one app for the bipolar disorder, there's one app for diabetes. There will be other apps for specific topics. And that's a view of the data center. The screens are those of that you can log in and see live. There are multiple ways somebody can participate in this. The important thing is that this is designed to be free now and forever for the users. So there's no payment and there's no planning in the business model of any payment from an end user standpoint. The platform, of course, will sustain itself thanks to sponsorships. So there's an opportunity for different kind of stakeholders, including pharma companies, and you'll see more in a moment, to sponsor and made available the vertical communities in a specific country or in multiple countries to the general population. But for the end user, all the services, including the access to the apps, the data center, the mining of the data, the reports, all of those services are completely free. We are developing different ways to link businesses to people who. One of these ways is the seal that you see on the screen right now, which a patient association or a pharma company or any of the players and hospital can basically add to their own digital communications once they become involved into people who. And before closing my presentation, I just would like to mention, which is one of the other charts that is not there, that the 5 illnesses that you have seen on the screen are each one backed up by one pharmaceutical company in Spain. So when also this morning we talked about can a pharma company afford to be engaged in a platform with data, with open text discussion, my friend Alex was mentioning that. The answer is yes, but it takes a lot of work. This platform has been 3 years in the cooking at Razorfish Healthcare, the global agency that I'm proud to serve as global president. And we worked a lot with the pharma companies, regulatory bodies, their legal teams in order to conceive a platform that would respect all the standards and regulations and the very strict privacy concerns that pharma companies have. So, of course, there's complete firewall between the personal data and the access to the reports that the companies can have, as our good friends at Patients Like Me did already years ago. But we had to go beyond this to allow a pharma company to participate and to make available a platform with open text. For example, if any user types a drug name, the drug name gets immediately substituted with the active compound, so to neutralize the trademark. So we added a number of those things, and the result is a platform that multiple companies, mentioning Pfizer, Novartis, Lilly, have been able to sponsor and made available to the general population. So I think this is just a closing remark to hook this to the pharma side of the equation. With this, I thank you all, and I'm sorry for the sequence that was messed up. Thank you.